Dr. Rashmi Chandran, CEO, AltaCair Foundation. I recently had the privilege to go to Washington, D.C. during the legislative days. I went as a part of a larger group called Bread for the World, that is also a non-for-profit 501c4. So they are into lobbying and advocacy work. I was introduced to that organization through our grant writer, Felipe Salinas, and instantly fell in love with the organization because of the cause. So they fight for hunger and food insecurity, one of the issues that AltaCair fights for as well. So, you know, we have been doing food distribution in some of our colonias, and we are very well aware of how important a role food plays in the lives of people. I think everything really stems from food insecurity and hunger. When you're hungry, from children to older adults, there is disruption in everything. How you feel, how you function, how you're able to progress in life, your mental health, everything is connected to food. And what food you consume is also important. So hunger always gets sometimes confused with just eating something, but that is not how you satisfy hunger. Nutritious food is everybody's right, despite of poverty levels. So what you consume is very important, and often, as you know, in the population that is in an underserved community, it's usually processed food or very limited options of food that they are able to access, and that affects their health status, and in turn leads to other medical complications which they cannot afford on a routine basis, and ends up being the ER, again disrupts the entire dynamics of their life on top of what they have. So this is a very important cause for AltaCair to advocate. We were in DC for 3 days. The first day was a conference with Bread for the World. It is a faith-based organization, so it was an amazing experience to be centered in between people who believe in God and believe in the service and Word of God that calls for service. We were given a lot of legislative updates and training on how to lobby and advocate with the leaders in the Capitol Hill, so that was very informative. Because there is a way to present the information. So we advocated for 6 items, 3 domestic, 3 international. And I will touch mostly on the domestic issues that we touched on. SNAP is a big important benefit that our RGV really needs. A lot of families, you will even hear success stories that have come out of poverty because they had that SNAP benefit. And right now it is in danger of completely going away. The new rules pretty much say that because of the error rate, which is not fraud, error rate happens because of clerical errors. The error rate being high for certain states, the mandate is that if the error rate is not decreased within a certain time, which is a shorter time period within this year, the SNAP benefits will have to be cost shared by the state, which means federal funding for SNAP will not be there and the state will have to contribute. State, as you know, cannot fund $1 billion for SNAP benefits. So ultimately the risk is that they will just stop benefit overall. And we really cannot even think about that situation. We cannot afford it because we have too many families dependent on SNAP. So our ask to the senators and to Congress men and women was to delay the cost sharing proposal so that the error rate that our state is at can be brought down and we can secure SNAP funding from the federal government. So that is something that we spoke about. We met with Senator Cornyn's office, Senator Ted Cruz's office, Congresswoman Monica de la Cruz's office, Congressman Vicente Gonzalez's office, and Congressman Henry Cuellar's office. And that conversation was successful. The other thing that we spoke about was Modern Act for WIC. WIC stands for Women, Infant, and Children. That is another benefit that is extremely productive, if you will. It has been used in a very efficient way and is extremely beneficial to new mothers, recurring mothers, infant health, and all of those good stuff, right? And so right now we do have a provision where people can prove their eligibility and do the eligibility process remotely. They can access it from their computers from home. Now this is supposed to end in September. Now what that will do is everyone will be required to go to a brick and mortar to submit their documents, and if they don't, the WIC benefit will fall out. And that is a huge issue down here because we have transportation issues, and we know not all our people can go to these offices and submit these documents, especially when they have small children. You know the childcare issues down here. So our request was to pass the Modern WIC Act, which enables permanently for everyone to continue doing their eligibility remotely. That way WIC is protected. Along with that, for WIC, the vegetable and fruit benefits were actually removed. And it doesn't cost much to put it back. So our request was to do that because, again, for these underserved population, the SNAP and the WIC are the only sources through which they can get nutritious food, which is vegetables and fruits. So that was our second ask. The third ask, which is also a lot of advocacy for our non-for-profits, and I'm very proud I was able to speak for all of us. The data, household hunger survey data, that data is so useful, as you know, brothers and sisters. We use that data to get funds with the grants. All our grants require us to have a baseline data, and then that's how we justify our work and ask for more funding so that we can help more people. Now, if you don't have that household survey, there is no baseline data. You are just estimating and giving random figures, which you very well know that the grantors do not accept. So private foundation and even state and federal grants require quality data for grants to get approved. And so we need that household survey to resume, and the budget for that is not more than $1 million, which is nothing compared to the other budget items in the bill that is being passed. So that was another ask from our government officials. We were able to give a lot of the letters that were written by the constituents of our RGV, which was very touching to the politicians. So I encourage you as organizations and individuals to write to your local leaders, and those letters, those voices do reach DC. So it is very powerful. Your voice is very powerful, and we want to convey it in that forum in the form of letters. So continue to do that. And with the international forum, there were a couple of bills that was pretty much, again, to fund the countries that are underdeveloped and are going through war, and there is severe famine or war hunger going on. And as one of the blessed nations of this world, I think it has always been our role to supplement the countries that cannot afford much. So our request was to continue funding those countries with as much as possible, and also support their vaccination funds for AIDS and other pandemics. And again, COVID was a big example of that. If the other countries, our neighbors, are not protected, there is always a chance we won't be protected. So it is our concern to protect all around us and to have a worldly healthy environment.